That's it. The recording starting.
Okay, welcome to this first meeting of the Ad-Hoc COVID-19 Sub Committee. Nick, can you provide the sederant and any apologies, please, and confirm which members are present this meeting virtually via Teams?
We've had apologies from Councillor Scobie, and Councillor Nicholson is substituting for him today. We have Councillors Davidson, Carruthers, Johnston, Maitland and Thompson attending via Teams, and in line with the change with standing orders we've recently made, you've agreed that members can attend today remotely.
Thank you. Do members have a declaration of interest that they wish to make? No? Okay, if we proceed to item 3, this is a standing item of the subcommittee, whereby members will be provided with a verbal update at every meeting on our Council's response to the COVID-19 pandemic. Richard Greaves is in attendance at the meeting to provide this update to members. Richard.
Perhaps, Leader, I'll pick that introduction up at this stage, and I'll pass over to both Richard and then Gillian, particularly on schools and education. So last week we updated members through a question and answer session at full council 7 days ago indeed, and it feels like much longer, and especially given the challenging and intensive week for council services, for the public, for our businesses, for our community at large. We've reacted and responded to the requests of government, the direction of our health colleagues, and indeed the needs of our communities through that time. And members will be fully aware of the series of government decisions and announcements escalating advice for the public through that period, health and public health requirements, impacts for businesses and the help and support that's being developed and provided for them, and indeed the guidance around childcare and education for key workers, and indeed for our secondary school pupils who are ready or were ready to take exams. Taking account of that very fast moving and difficult agenda through the last week, we've been focusing on the key roles that we need to take as Category 1 responders in the Council to protect the most vulnerable and indeed to support business and our communities. Members will be fully aware that the COVID-19 pandemic has been declared a major emergency under the Civil Contingencies Act. Unlike any other situation where Police Scotland or indeed the Fire Service may lead on this emergency lead sits firmly with the NHS and with the Council. And together, through our local resilience partnership and working with the national structures, we've been in constant dialogue, and Richard will be able to provide a wider update on that shortly, as part of the detailed response arrangements and indeed the escalating position that we find ourselves in. I have to also pay credit to the wider group of partners that we've been working with, who've been providing support and assistance to respond to this emergency, including G College and South of Scotland Enterprise Agency, as well as the wide range of local resilience partners, and also a number of businesses and private sector organisations who have been invaluable in supporting us both with the planning for our response and supporting us through the last week, but also offering their help and support as we move forward. I also wanted just to mention our thanks to the staff across all services who continue to offer their help and support to deal with this response, but also have worked diligently and with patience to adopt very different working practices and arrangements for their own services over the last 7 to 10 days in this unprecedented time. That change has taken a lot of work and a lot of support from our excellent services, and staff have been immense through this period. I can't commend individuals and groups enough, and I think it's important that we recognise that. There's a series of updates on the agenda in a more formal sense today, both from the Chief Social Work Officer, Lillian Kringles, and Steve Rogers, who's leading on the support for business. So I won't provide any specific information on that update just now, and there'll be a chance to discuss them in more detail. Liz Manson is also here in terms of her role as Community Planning and Engagement Manager, in terms of some of the work we're doing on communities, which Richard will touch on initially, and areas for decision for members. As I said, Richard's here on his response role, and Richard's taken up under SLT that response role, working with both the Silver Command of the Local Resilience Partnership, which Julie White's leading on, and indeed the Gold Command, which both ourselves, both Chief Executives from the Council and the Health Service are leading. I think it's important also just to pick up a couple of other areas of business as usual, and members will no doubt have considerations about future reporting to this committee around some of those areas, and we'd welcome your views on that, particularly around business continuity and some of the core services that we need to continue to provide, even through the period of social isolation and public order that's been required by government, things like waste provision, but also the support indeed to support your working and our working through this period as remotely as we possibly can. We have established the control centre here at the Bridge that will expand, and Richard will extend some of the information about the activity that we'll be conducting and intensifying over the next 2 to 3 weeks as we predict the pandemic cases will escalate and increase. So really just as an introduction to make you aware of that activity over the last week, and also to invite some thought and comment around the communications that we've been trying to get off the ground this week to support members, to keep you informed, and very much welcome your feedback on that, but also in terms of what other information do you need to know, and we will make sure that we can provide that to you. So happy to take any questions at this stage, and then I would maybe ask Richard to take on the response in detail with you.
Okay, thank you, Lorna. Any questions for Lorna? Any remote questions? Okay. Ian?
Comment, I just think the communication information flow to members is very good. It's information overload. There was criticism certainly from my group, and probably an over involvement to start off with, but I think that's been rectified. I noticed you also sent out an email as well, Leader, into the whole council. I think that's been recognised, and under the circumstances that was the right thing to do.
Any other questions? Any other remote questions or comments? Okay, thanks very much, Richard.
Thank you, Leader. Good morning, members. Just perhaps to start by reaffirming some of Lorna's comments in terms of the partnership and where we are in terms of the status of the emergency. The Dumfries and Galloway Local Resilience Partnership has been stood up, and a major incident has been declared. And that's really, really important under the terms of the Civil Contingencies Act 2004, and as a consequence then applies additional resource and responsibilities on the chief executives of both NHS and the council in that regard. The strategic, if you like, or gold local resilience partnership is meeting weekly. And that predominantly is around looking at the NHS data specifically, the clinical data in regard to the pandemic, any key issues that the NHS have, and working closely with the local authority in terms of how we might brigade resources to use that intelligence and that data in order to allow us to work swiftly and effectively together in terms of our planning and our response to any given set of circumstances. The Strategic Local Resilience Partnership reports through the West of Scotland Regional Resilience Partnership, and that's our direct line to Scottish Government. We had our second meeting yesterday, and I'm happy to report to members that I remain confident in terms of the message that I gave to you all last Friday, that we're in a really strong position in terms of our preparedness for what faces us in the many months ahead, and indeed the reaction to what has happened thus far. We are certainly feeding through in terms of the Regional Resilience Partnership, and in comparison to other authorities, I think we're in a good position. Indeed, we're helping and supporting in terms of sharing of some of our processes and procedures to support other authorities and other partnerships in terms of their approach. Particularly, I think, in terms of our effective collaboration, which is taking place between Local Authority Health Board, third sector, and that will be critical in terms of the sustainability of our response to this emergency, which we know will go on for a number of months. In terms of the tactical local resilience partnership, that too is meeting weekly, and again Lorna has touched on that. The main focus of this last weekly meeting has been our approach to shielding, and I'll come on to tell you a little bit more about that in a second. But the other key areas of focus for the tactical group are communications, and the work that Mark Malloy is doing a sterling job, I believe, within the council in terms of comms and liaising very closely with the NHS lead in terms of how we can more closely align our comms, albeit we're very specific around the work that Mark's doing in terms of our response to the situation, the emergency, and the work that the NHS are leading on in terms of the actual reporting on the pandemic itself. Nevertheless, I think there's an opportunity for us to work closer together moving forward, and Mark and his colleague in the NHS are taking that forward. The other work stream that we're working very closely on is workforce, for obvious reasons, and again I'll come on to talk a little bit more detail in a second about the challenges that both the NHS and the council are already having to address in terms of workforce, and again the opportunities in terms of realigning workforce in order to address those challenges moving forward. In terms of sort of general updates, I'll start with shielding, if I may. We're really shielding, as members will be aware, is a developing initiative to protect those most clinically at risk from COVID-19. We're currently working with our colleagues at a Scottish Government and national level in terms of collation of data sets. Lillian's team is critical to that in terms of local reporting, and they're very much involved in supporting and bringing together that data set from NHS Scotland, aligned with our own data set resources to allow us to identify those most clinically at risk. Thereafter, we'll be contacting those individuals. There should be letters going out, we think, by the end of the week. And next week, then we will be following up those letters with direct contact, which is something that we will be leading on with Lillian's team, social work access team, excuse me, in addition to other staff from across the council who will come together to provide that resource so that we can reach out to those individuals to ascertain their specific needs and requirements. Thereafter, we have established a number of community emergency hubs, 16 premised around the school estate locally, where we have already started to bring together the type of resource that we believe will be required to put in place systems and procedures to access the resource that's required. We are being advised by government in terms of national procurement of food and other medical supplies, etc., which we'll get to those emergency hubs, and then using the resource that we have either within the council in terms of our transportation and our community staff, the significant support that we've had from the third sector and community groups to help us to distribute those key packages to our most clinically at risk and vulnerable communities right the way across Dumfries and Galloway. Again, feeding back from the West of Scotland Regional Resilience Partnership as of yesterday, I think we're in a very positive position in terms of our planning that will allow us to roll out that critical resource to our most clinically at risk from next week. Another area that I just wanted to update members on was key workers. Members will be aware of the information that we've circulated in regards to the critical key worker roles, which have been clearly defined and identified. We've used the government guidance in that regard, but in Dumfries and Galloway, we have enhanced our offering to ensure that our local critical businesses are also included. I'm sure Gillian will touch on some of the work around childcare aligned with that activity in her update. We're very much adopting a multi-agency approach working across businesses and public sector to provide the required support, specifically in regard to childcare arrangements, to all categories of key workers. And we're certainly ensuring that all three of those categories that have been defined are being responded to and supported to in equal measure. Third area that I just wanted to update you on was in regard to Youth Beats. The Youth Beats Festival was due to take place at Park Farm in Dumfries on the 27th and 28th of June. As members will be aware, this is our council's largest youth event with 40,000 people expected to attend, and has been running for 11 years. And there's already been a significant amount of work undertaken in terms of organising and planning of the festival by our volunteers and our staff. In light of the current Scottish Government guidance on mass events and social distancing, this event cannot go ahead on the planned dates. Discussions are taking place with the venue owners around potential alternative dates for late 2020, but will only take place when the government advise on mass events and changes in that regard. So once we have more detail firmed up, we'll A, inform members and B, obviously through the communications cell which Mark is leading on, make sure that information is communicated effectively. Fourth area is regard to some of the policing changes and some of the challenges that the police are facing. Members will receive a letter today, if not already have done so, from the police and Chief Superintendent Linda Jones in regard to our local response to the emergency. Recent changes to the Lord Advocate's guidelines, which will help ease pressure on the justice system at this critical time, and also how we in Dumfries and Galloway and the police in Dumfries and Galloway will be able to provide you with confirmation and assurances that all proportionate steps that are necessary to protect the health and safety of communities across Dumfries and Galloway from the police are being taken. So Linda will be writing to all members today to update you in that regard. Just a little update on the current picture in terms of, if you like, the pandemic itself. This information, members, is as of 2 p.m. yesterday, and that position has already changed. But this is as of 2 p.m. Yesterday, and the NHS will obviously publish updated figures at 2 p.m. today. I'm not at liberty to share any other information other than what was publicly announced yesterday. So across Scotland, nationally, we've got 894 COVID-19 positive cases. We have 39 in Dumfries and Galloway, with 9 patients in the respiratory ward in DGRI, but fewer than 5 of those are in critical care at this time. The NHS are remaining very focused on discharging patients at the point where they no longer require medical care. They're issuing letters to patients in hospital advising them of the need for them to free up as many of the NHS beds as possible to help prepare for this epidemic and to support the strategic intent and minimise excess deaths. And that's really picking up on Lorna's point earlier that we're now planning for what we know will be a significant increase and a significant pressure on the NHS resources within each of the hospitals. Indeed, the evidence from the other countries show that that this will have an impact on the NHS's ability to support the surge in patient demand. And there's a lot of modelling going on nationally in terms of when Scotland will expect to reach the peak and the significant challenges that will cause. Most recent modelling shared yesterday is that the end of April into June is likely to be the timelines that we're talking about in terms of reaching the peak. And that will require NHS to work with families, friends, carers, volunteers to provide the additional support required in order that the statutory service is focused on delivering support only to those where there are no other alternatives. And that's been very much stressed through the Strategic Resilience Partnership and the discussions that we're having. I'll leave. Obviously, we've got a detailed report from Lillian today in terms of social work services, so I'll not touch on the detail of that. The only thing I would say, that from my perspective as a strategic lead, the work and support of Lillian's team and the partnership approach that we've taken across the local resilience partnership has been first class. Lillian's team have really absolutely stepped up to the mark and are delivering really responsive, fantastic services aligned with internal and third sector support, NHS support, etc. Again, education. I know Gillian's going to touch on that, so I'll leave the education side with Gillian in terms of particularly picking up the child support in regard to key workers and some of the other education-specific issues and challenges that we've been dealing with. Lorna's touched on business continuity and some of the issues, challenges we've faced and are facing in terms of some of our key areas, waste being one, and the challenges we've got in terms of workforce. Again, the workforce cell is critical to how we address these challenges, and I'll come on to talk about that in a second, if I may. So in terms of the cells, obviously at full council last week, I updated members of the approach that we were taking in terms of the structure and the model that we've established, the framework to addressing the challenges that we have now and that lay ahead. And we've established a number of cells, as members will be aware, to address that. In terms of information and surveillance, that work has commenced now in collecting critical data and information on a daily basis. The council's senior leadership team are receiving a daily situation report, a SITREP, in terms of that critical data and information flow. That will be continued to receive daily and will inform the decisions that require to be escalated to the SLT of the council. The NHS and Health and Social Care also produce a daily SITREP, and we're now aligning those two documents so that, again, we can make sure that we're able to brigade the resources into the critical areas that are required moving forward. Communications, the communication strategy has been implemented to ensure appropriate, accurate, useful information is being delivered across a variety of platforms and to a range of audiences. I've mentioned that our response as a council is very much, in terms of comms, leading on the response as opposed to the NHS on the pandemic itself. And again, as I mentioned earlier, Mark will be liaising closely with NHS colleagues moving forward. A couple of key updates, I guess, in terms of comms. Community councils and affiliated groups are receiving continued support to update and put in place the resilience plans. Activities in place in every ward to do that, and many active food sharing groups. And again, Liz's report will go into detail on some of that activity. We have over 800 volunteers registered with the third sector in Dumfries and Galloway, and the chief exec of the third sector now forms part of the tactical local resilience partnership, and the input there has been critical in terms of, again, identification of third sector volunteers and the brigading of those resources aligned with what's happening in the NHS and the council to make sure we maximise the impact that those individuals can bring. And over 150 organisations, including community councils with resilience plans and food sharing groups, are offering community support and have registered. And again, Liz will give you more detail of that in her report. In terms of economic recovery, you've have a report from Steve, so I'll let him touch on some of the fantastic work and very prompt, quick action that has happened this week in Dumfries and Galloway to give members further assurances. I don't necessarily see that the promptness and the speed of response are being replicated in other authorities. So I think the work that Steve and the team have been doing has been first class over this past week, and I commend them for that. I mentioned workforce earlier. In terms of the workforce cell, that's really picked up a pace this last week. We at senior leadership team are being presented with significant data in terms of numbers of staff self-isolating, and numbers of staff working from home, which is obviously a positive in terms of the work that's been required and directed, but the social distancing and the opportunity to do that from home as opposed to bringing staff together is absolutely being driven by managers, and that's as I say, a positive step forward. We're also being given data on sicknesses, on colleagues that are home working, as I say, and other critical statistical data in terms of at-risk groups across the council, so that we can make sure that staff are being given the correct level of support, guidance, and as we move through the pandemic situation. The other critical part of workforce now is endeavouring to identify how we can support and supplement the work that's ongoing within the council, not just through the voluntary sector, but also with key partners. Some really good contact with the college today in terms of the number of college resources and indeed staff that are helping and supporting us in terms of some of the work that's required and the skill sets that are required, the very broad range of skill sets that are required, from comms to graphics, as well as the frontline support and services across the region. So there's various partnership arrangements in place and are being developed. We now have identified 245 staff at the time of writing within the council who are not involved in sort of core activity and are now being directly redirected into areas of support and areas of pressures. Most notably, you'll have seen members of staff from other areas of the council working on waste as of yesterday to try and address some of the pressures we've got there, and that indeed is picking up a pace now across the region. Those discussions are also happening with NHS, because NHS are obviously now having a number of staff that are self-isolating and are having some pressures, and where that's possible, we're aligning that any particular resource that we have that we can redirect to NHS colleagues, as well as within the council. Health and social care is another key area, and of course our response as a priority to shielding is where a number of staff are being redirected at this moment in time as well. Bereavement and excess deaths is something that we are planning for and working with, both in terms of ongoing dialogue with funeral directors and indeed getting and GPs and the NHS getting guidance from nationally from government in terms of the peak and how we might work together to plan for the potential of excess deaths within the region, as are other local resilience partnerships across the country. And that is a piece of work that's ongoing. It's certainly increasing. Harry Hayes leading on that cell within Dumfries and Galloway, and plans are afoot, which I can perhaps update you further on in the weeks to come in terms of how we respond and prepare for that. Logistics. Lots of work ongoing in terms of the provision of school meals. Again, Gillian can touch on the uptake that we've had in terms of free school meals, and more recently our more proactive response in terms of being able to transport meals to key individuals who are at risk, rather than the individuals having to come into the schools, and that's now started. In terms of remote school meal provision. Lots of work from the logistics team around shielding and supporting our response to shielding, particularly in relation to food, but also in terms of the procurement of supplies, so our staff have the appropriate PPE that will allow us to fulfil our functions right the way across the local authority. We have now a central cell and have coordinated the procurement of PPE. We have sufficient supply as things stand, and we're planning ahead for obviously what will be an increasing demand. But at the moment, we have certainly sufficient ongoing provision of cleaning, janitorial, catering provision, and indeed the requirement for PPE in that regard. Estates, updated briefly members last week. We've obviously reduced the number of buildings that we're operating from. The bridge is now the emergency hub for this response, but predominantly we are now only operating out of a fewer number of buildings premised around the customer service centres. So we're not having staff in other parts of the authority working, if you like, in office accommodation alone. We're endeavouring to make sure that we reduce the number of buildings that we operate from, and that they're the required buildings. Transport, council's transport team are based in here as well now, in the bridge, and again very much supporting the shielding plans, the enhancement to the free school meal provision and the development of the outreach programme in that regard. We've realigned where pool car provision and indeed other council fleet are based, so that we can make best use of that resource and target that again in a true community planning approach with colleagues. So those vehicles are not just being used by council, but they're also being used by partners and will be used by voluntary sector moving forward in terms of the approach that we're taking. I've mentioned some of the community support. I'll maybe not go into too much detail in that regard. I'll leave that to Liz to update you. And indeed the food and the food cells, the local community food providing partners, and the contacts that we've got in that regard. That's Leader, probably an update of where we currently sit. Just to reaffirm, I think we're in a very positive place in terms of our preparedness and the actions that we've taken thus far. And the response and the planning for the forthcoming challenges ahead. Happy to take questions.
Thanks, Richard. Clearly, a lot of work been going on. Congratulated you for all the efforts of the staff to try and get all this together in such a short time. Can I take any questions, Ronnie?
Yeah. It's okay. Thanks very much, Richard. A very comprehensive and detailed report from yourself, and I think just to echo Elaine's comments about the workforce. I'm absolutely blown away, as well as everybody else, about the effort, the commitment most of them are putting in, and I think they should be congratulated on that. Your comprehensive report touched on that many different aspects, but I'll try and keep it as strategic to you as what I can, because there are lots of things in there that you can comment on. But I wonder if you could expand on the procurement aspect, guidelines from the Scottish Government for food. Was that on a local level? Is it on local farmers, or is it on how local businesses? How kind of where is this coming from? The other thing is that you mentioned a bit about communications, and that and it's very it's good what's coming out. But and it's good that 245 staff, are actually working towards other jobs and training for other jobs and that. But some of the communication, when is it actually going out into the public? I think that there's a public communication due, and when is that going out? Because people want to know where they can go for help, what's being done, how does this affect me, how can I get something? This is the kind of questions that I'm getting from the public as well. I think it would help a lot if there was more public communication, and I think that's in the pipeline, but I don't know when that's happening. The other thing about, and I know it touches on the care at home thing, but with your NHS and your council together, can you tell us how many, for example, spare beds is in the hospital for people that? Obviously, there's got to be more people using that in the near future. Can you tell us how many spare beds are actually there? It touches on the care at home and the announcement about bed blocking, as it used to be called, and people coming out in the community, and then family being asked to look after them. It was a bit counterintuitive to me, because they're supposed to keep away from people that are in medical needs. So I don't know if you can touch on any of them without going into somebody else's sphere.
Okay, thanks, Councillor Nicholson. Certainly take your comments back to colleagues in terms of their response to the situation thus far. Certainly, in terms of procurement, I guess there's a couple of stages to this. In regard to the shielding arrangements, things are changing quite frequently. However, the most recent information is that we will receive food parcels aligned with the shielding requirements from a nationally brokered procured route. But we have we're able to supplement that. We're able to increase and enhance that with local arrangements. Where Alan Mawson, who's leading on this, is already working with a range of partners locally to make sure that we've got those required supplies in regard to food available to us. And of course, we're working with local businesses to make that approach as flexible as we possibly can, recognising the economic impact as well. So it's a very much an approach that involves all elements thereof. But we've got national procurement, and we're dealing with it locally as well, and supporting local business. I can get more detail specific to those elements from Alan. I'm happy to share that with members moving forward. Communication, I think we've made great efforts in terms of the various platforms that we're now using in terms of comms across the region. That will continue to pick up a pace. I think the plan is for Mark to bring a paper to next week's meeting with more detail around our approach moving forward. And certainly in terms of signposting, making sure we're getting the information, the questions back and reacting to that communication cell is really at the hub of activity here, linking with others. And I think, albeit we're only a week in, I think we're already seeing some fairly quick and responsive actions to that. In terms of hospital and beds, I don't have the exact number. Again, we've got a strategic local resilience partnership this afternoon. I can get an update, but in broad terms, the last conversation we had with colleagues, there was that the hospital here was around 60% availability in order to react to the pandemic as we were last time we spoke. But again, I can get more detailed information from colleagues when I speak to them.
Okay, we've got Ivor and Adam wanting to speak. I'm just going to go around our remote colleagues, and if you could just tell me whether you have a question as well. So Ian, do you, Malcolm?
Yeah. No, I'm quite happy at the minute. It's been very comprehensive.
Okay. Stephen? You just indicate if you would like to, you've got a question.
Yeah, but I think the only...
yeah, I'll take you later. Jane, do you have a question?
No.
Rob? Rob, do you have any questions? We've got Rob still there. Rob? Pretty well lost. Anyway, okay, Ivor.
A couple of points that members sort of raised with me. They've had contact. Key workers. There's people sort of being asked to go into work who feel that they're not key workers and they're not being given the 2 metre social isolation space within their workspace. My understanding, some of those workers have family members who would fall into at risk through things like cystic fibrosis or whatever. Are they, or is there anything we are doing to sort of make sure that they aren't put under strain by being threatened, job losses, etc., that if they don't turn up? And the other one you mentioned was PPE. You said that there was sufficient PPE. Is that within the council or within all services? Because some of the members have had issues from constituents with regard to PPE in the health sector, if there's enough and sufficient for people there.
Thanks, Councillor Hislop. Through you, Leader. We're certainly providing advice and guidance to businesses in terms of key workers status, and you know, we'll continue to do so. Obviously, if you're referring to businesses out with the partner, the resilience partnership to NHS and council. They're very much responsible for responding to the national direction on key worker status within their own businesses. But we have had contacts, I know, through Steve's team, and there has been advice in terms of compliance and support in that regard. Happy to pick up any specific cases that you're aware of, and we'll do what we can to advise and guide accordingly. In terms of PPE, yeah, the statement is very much within the authority in terms of where we're at. However, again, we're having that dialogue with the NHS, and we will help and support as much as we possibly can, you know, in terms of making sure that we share the resource that's available to us, albeit on a priority basis. And clearly, the NHS have some significant issues in that regard in terms of the issues they're dealing with.
Thanks. Adam?
Just 2 points. First of all, on the food distribution, I appreciate you're going to bring a report, but I noticed that the government had mentioned putting together a national contract, which you have mentioned, but also as well that third sector Dumfries and Galloway put a call for drivers. And I think for me, part of it is that surely we're trying to prevent the spread. So actually, you know, volunteers is absolutely fantastic, but I would have thought that those volunteers should be sticking within their sort of locality rather than distributing food up to, you know, from Dumfries to Tesdale or whatever, but also as well, you know, the fact that we do have a number of local companies who are used to distributing food on a daily basis and will have the equipment in order to do that, and obviously to put together that economic recovery and trying to keep as many businesses going by as close as possible. So I'd be keen just to get clarity on actually how that is working, because I think there's a number of local businesses who are feeling a wee bit that actually they could be doing that work, but at the same time, how does that fit into that national picture? Because, you know, one national contract in my eyes is never going to achieve getting food out to every single individual who needs it. Secondly, the point I wanted to make was just around local pharmacies, and I'd be keen to know if you've had any discussions with your NHS colleagues in the various groups and the structure that's in place. I'm quite concerned at the number of people who are having to wait at pharmacies where 2 metre gap to get medicines, and I appreciate there's, you know, been a lot of not bulk buying, but there's been a lot of bulk prescriptions because also the panic's now spread to medicines, and some unfortunate in my extended family got the short straw of going to pick up every you know, batch of medicine, putting it through letterboxes and things. But I'm quite concerned at the number of people who are standing waiting. And if they're collecting medicines, they most probably have some sort of vulnerability and the potential for spread there. So we're quite keen to know what discussions you've had with the NHS. I think it'd be quite easy for some of the private providers who have transportation means themselves to actually go around and deliver prescriptions. I might also take the pressure off the staff who are working within these pharmacies. So quite keen to know if there's been any discussion around that, or if we can actually start to look at an alternative there to, you know, help to keep people in their house and to prevent the spread, you know, at pharmacy.
Yeah, thanks, Councillor Wilson. In terms of the sort of volunteers and the supply, distribution, the food parcels, etc., I think, again, we've probably been a bit ahead of the game because whilst the national procurement process has now come to fruition in a direct response to shielding, we were already out there in terms of the dialogue that was happening at a local level in terms of collating that resource. So the approach we've taken within the community cell, and again, probably Liz will touch on this in her report, is very much premised on ward provision. So we've broken it down into each ward, and we're looking to distribute and support our local communities in that regard on a ward level, using that additional resource from volunteers locally. So we wouldn't expect an individual to have to travel, I don't think, any further than that immediate geographical location in terms of the support that we're requiring of them. And again, we'll give them as much help and support as we possibly can in terms of PPE, in terms of guidelines and procedures, and in terms of transportation. In terms of pharmacies, medicines, there hasn't been a significant amount of discussion thus far. We have a strategic LRP this afternoon. I'm happy to raise that and feedback to members, if not before, then certainly at next week's meeting. But I recognise the points that you made, and we'll feed that through this afternoon.
I don't know if it's true, but I did see some, I've been out for a week, I did see some comment that somebody had waited that long in the line for the chemist and then only to realise there's actually a queue for the caffeine oil. Now, that might be a joke, but you know, I mean, I think it shows actually the lengths of lines waiting to get into a pharmacy. You know, that I think that there's a much better way of doing that than having a whole lot of vulnerable people stand outside a chemist.
Ian?
Thank you, Leader. Just clarity on Ronnie asked a question around about got an answer certainly around about the capacity in DGRI. 60% availability, I think, is what the answer was. Does that mean it's sitting at 40% capacity at the moment? Another question I had for myself was workforce and testing. Obviously, you've touched on workforce. I think it's just so important in order to get people on the ground. The testing has to up its game. I don't know how we can possibly influence that, Richard, but the information was made available to certainly IGB members, but the Community Planning Partnership Board as well. As soon as schools closed, NHS would lose a fifth of their workforce. So I'd imagine that's happened. But as a number, whether it's with the council, whether it's with the NHS, there's a number of people I think could potentially be out on the ground, but because they haven't been tested, but they're showing signs of being COVID-19 positive, they're sitting at home in limbo, finding it very, very frustrating, and that's quite across the board actually. So the workforce and the testing, I asked a question earlier on, a week to a fortnight before that starts to get into some kind of orders, the answer I got. Anyway, I'm speeding that up, I suppose. And just to thank you, yourselves and your team very much. So I think information flow, what you're doing, very well recognised, and thank you very much for all the work that you're carrying out.
Yeah, thanks, Councillor Crows. I'm going to pick up the testing first. That it is a matter that's been discussed weekly at the tactical meeting. The pressure on testing and the numbers has certainly been a significant issue, and there's no appetite at the moment to extend the testing regime beyond what's currently in place in terms of the guidelines. Within the NHS, indeed, within Dumfries and Galloway, we've seen some of the data come through in terms of the number of positive tests. That's possibly premised on the number of tests that we have been doing in comparison to our other partners and other parts of the region. So it's a matter that's on the agenda for weekly discussion, and we'll receive weekly updates. But there is a significant pressure on that area, and certainly the timelines that we're now working to in terms of getting the test results back have changed from where we were 2 weeks ago. So it's certainly something that NHS colleagues are requiring and indeed being instructed to monitor very, very carefully. But happy to keep you updated as that continues to be discussed, and I guess the pressure continues in that regard. Forgive me, what was the first question, Councillor Carruthers?
Councillor Nixon asked a question. I think you came back and said there was 60% availability at DGRI. Does that mean it's in a 40% capacity? Just a clarification on that.
Yeah, I guess I caveat that was a discussion that we'd had last week. They were very broad figures. I will go back this afternoon and ask the question and try and get members with some more detail in terms of exactly where we're at just now.
Thank you.
Stephen? Stephen, you had a question?
Yes, thanks, Peter. Sorry, I'm just getting used to the technology. Yeah, no, I'm encouraged to hear earlier on, Richard, when you were talking about the communications cell coming together, because now more than ever we want a single source of correct information that's updated and reflects the actual situation in the ground. So obviously there's been a few teething issues with the waste information in the last few days, just since Monday. In fact, it's changed a couple of times. Obviously that's coming together now to a consolidated position, and you've got staff moving across to help out, which is encouraging. Have we now learned from that? Because clearly that was a lot of people got a lot of mixed messages from Wigtonshire to Langham about what to do with the side bags, etc. So I take it we're on top of that now, and we know what we're doing.
Yes, thanks, Councillor Thompson. I think this thing is obviously a challenge in terms of the pace of change and how we need to react very quickly to the situation, and indeed the impact on the workforce locally as a consequence of safe isolation, etc., etc. But we've had a discussion internally about the importance of communication and doing it once and getting it right, and also making sure that the message is a positive one in terms of the uplifts, etc. in terms of waste. We're not impacted. We're endeavouring to put in place additional measures to try and help and support communities in response to the closure of the HWRC sites. But yes, absolutely. My colleagues in the business continuity section are obviously reviewing how we move forward, and we'll make sure that the comms come out promptly and accurately moving forward.
Rob, I think your mic wasn't on. Do you have any questions?
Apologies, my mic wasn't on the first time. No, I'm absolutely fine with the update. Thanks very much.
Right, thanks. Ronnie, you have
no, it's just a comment on the side waste, and I mean, people do understand what's happening out there, and they say to me, are we going to get the same services? You're going to get the same service, and we're trying to overcome problems with maybe additional side waste and things like that. But the reality is, things happen that quickly, and things happen in an hourly basis, changing on an hourly basis, and people understand that. And if their messages are getting out there, there's no complaints from them. So people won't get their bins lifted if we have the staff. If we have the staff, they won't get extra services if we have the staff. But as things change, there's no guarantee about anything. People do understand that, and they come along with it. So there's no issues.
a couple of things that I wanted to ask. One was about the process for follow-up for the people who are being shielded. And obviously they're getting a letter and then there's some sort of follow-up. Now, I wondered what the process would be for that follow-up, because if people are shielding, they're probably not going to want to answer their door to a stranger whom they don't really know who they are. So that was my first question. Second question was around the volunteering through Third Sector Dumfries and Galloway, which is quite a small organisation. If they're processing 800 plus applications to be volunteers, I know because Jeff and I both applied to be volunteers, you get quite a helpful sort of follow-up conversation with somebody, and they ask you about how far you would want to be prepared to drive. And I said round trip of 70 miles. But if you're saying that they're doing it in a ward basis, obviously that question shouldn't really arise, or whatever. So I just wondered, are we giving any support to Third Sector Dumfries and Galloway to be able to process those requests? Because obviously for a small organisation, just getting that sorted is going to be quite difficult.
Yeah. Thank you, Leader. So in terms of shielding, yes, we're hoping that the letters which will come from the NHS will go out this week. And then on Monday of next week, through Lillian's social work access team and additional members of staff, everybody on that list will get a phone call. And that will then clarify the needs and requirements of those individuals. And once we know what those needs and requirements are, then that will be passed to the local teams within the 16 emergency hubs that will then make sure that the relevant response is coordinated and is actioned immediately. So that's the sort of process that we're dealing with. In terms of Third Sector, I think I would describe it again. Liz has probably got more of an update, but it's a work in progress. We had established our ward sort of model and response team immediately. The Third Sector D&G then have absolutely, we saw the various Facebook sites come on, and we've only just then brought all of that resource together. But there's absolutely now very, very close links through the communications cell, and I suspect as we move forward, we'll get slicker in terms of how that approach is taken. But there is a close relationship. It is there. It is a partnership, but it's just sort of taking a week to come together, I guess.
Yeah, I think it's just if people are keen to volunteer and they maybe don't hear what they have to do, they could lose some of that enthusiasm for volunteering if people don't get allocated tasks to do fairly quickly.
Yeah.
Okay, Gillian, do you?
Yes, thank you. Thank you, Leader. Good morning, members. So following direction of the government last week, all schools and early learning childcare provision was closed last Friday to all but those providing childcare for the essential workers. So we've been putting plans in place over the last week. We agreed with the Health and Social Care Partnership that our emergency childcare would open on Thursday, which it did. And we also had provision from the initial, from Monday, for anyone who required childcare as a last resort. So the function of the schools, predominantly, as I mentioned, to provide childcare for essential critical workers, where they've exhausted all other opportunities for childcare in trying to minimise the number of children who are gathering. If we have large numbers of children gathering in schools, that risks undermining the health benefits of closing schools and early learning centres in the first place. So we've been trying to balance that. We also have to offer advice to our senior pupils who are preparing for next steps. Clearly the cancellation of the senior phase exams, it's the first time that's been done in Scottish education. It's 1884 that was introduced, and it's the first time that the examination diet has been cancelled. So that is very significant for both schools, college sector and universities, and also our employers who are looking for their own recovery arrangements as we move through this. We will also be providing support to the children who are most vulnerable. Our looked after children and our children with additional support needs, that support continues, and also the continuity of learning and support for all pupils and families. Although it's remote, it's different, learning does continue. The school buildings are also open for free school meals, although as Richard highlighted, the numbers yesterday picking up free school meals were only 39 across our region, and clearly again balancing the expectation on lockdown with being able to pick up a free school meal. We're now delivering these meals in a different way, so we'll be working across communities to make sure children and families have access to food, because it is counterintuitive to offer these meals in a large hub while also expecting people to stay at home. So with the analysis, we know where the children are. There's 3,500 children are entitled to a free school meal, and we only had 39 pickups. So clearly there are other models we can use, and that has already started. We are working closely with our Health and Social Care Partnership, but also with our key businesses. So we've been having personal contact with managing directors and HR workforce directors of some of our largest employers, particularly in the food production industry, and ensuring that childcare provision is offered. That has been at a very local level to be able to respond to local need. We have 14 centres across the Priest and Galloway open from Monday. We started with 16 secondary schools, but it became clear quite quickly that some of our secondary school pupils didn't particularly want to go to school where there were 2- and 3-year-olds or 5- and 6-year-olds there. So we have more appropriate childcare facilities open as from Monday, and that is from 0 through to 18 and for severe and complex needs. So there's a range of provision in secondary schools, primary schools, early learning and childcare, and our severe and complex needs provision. Also, and importantly for us, in conjunction with employers in some areas, that provision is from 7 AM till 8 PM, because we recognise as our health and social care workers have to extend their shifts, the traditional 9 till 3 model of schools will not meet their childcare needs. So we will respond to the need. It's relatively small scale at the moment. We had 71 children across the region accessing this care yesterday. But as the shifts build and the needs build, we are ready to respond and adapt to the childcare provision needs. Teachers are continuing to set work and progress learning for all pupils, and we're working with our trade unions to balance the expectation. And this is, as Councillor Nicholson or Councillor Wilson mentioned earlier, it is counterintuitive and it is a balancing act to provide essential services while also adhering to public health advice. And we're working very closely with our trade unions to make sure we adhere to the public health advice, and with our NHS colleagues to make sure that those who are providing essential childcare have got the right NHS infection control advice and support. And we have instigated deep cleans and electromagnetic cleans and everything that we've been advised to do by the NHS in this regard. I'm happy to take any questions. I'm not sure if there's anything else specifically you need to know.
Thank you, Gillian. Any questions? Bonnie, Ian? Anybody else remotely other than Ian wanting to ask a question? Okay, Bonnie.
Just on the, lots of families at home are trying to learn their kids, and what are you doing with? Well, how do you identify people that haven't got the facilities, like Wi-Fi or people that can't afford people Wi-Fi in their house? How does that work?
This is a big operation for us. we have had to pivot our service within 48 hours and been able to provide a learning at home service. And the only way to do that is through our team of head teachers. It's been fantastic response from a team of our 80 head teachers. They know their schools, they know their communities, they know their children and families. They are working in clusters. They're working in 14 clusters. They're on a rota. They've brigaded their own staff and their own teams to be able to provide support for pupils, learning provision and childcare. And for individual families who perhaps don't have access to laptops, I know that there were schools yesterday who were looking for advice to clean laptops and have cards inserted into laptops for certain children who then required access to IT to be able to help them. So it's difficult to get a one-size-fits-all because all our communities and the needs of families are different, but our head teachers know who they are, they know what needs they have, and we've also got lots of telephone contact. So classes yesterday, there were individual teachers phoning individual children throughout the day yesterday, making sure that they knew what to do and that they had the work and the support that they needed.
It's, you know, you answer by saying maybe telephones and various other aspects, and they do, you know, the right teachers do know their kids. There are some people that, you know, don't have Wi-Fi and they can't, and whether it be they're in a remote place or whether it be they can't afford the Wi-Fi. And it's the same with telephones. Some people have just, you know, we've got telephones that just make calls or text, so they haven't got that facility. So I think we should, you know, still have another look at that and just see who's missing, if you want.
Absolutely. We're just at the beginning of this. We've got a week before the Easter holidays, and I'm pleased that this will continue through the Easter holidays. We're not stopping for Easter, so this will continue through the Easter holidays. And I think we'll learn and we'll pick up and we'll establish where the pockets where the problems are, and we'll look for solutions.
Thanks, Ian.
Thanks, Leader. Gillian, you said that, I think you said there was 39 pupils across the region, young people taking up a free meal entitlement, and there's 3,500 actually entitled to do that. Kind of rings alarm bells to me, thinking, okay, there's hungry children out there. How can you give us the reassurances that this has been carefully monitored?
Yes, I was surprised to see the numbers yesterday, I have to say. The numbers were higher on Monday, but then clearly with the government announcement on the lockdown, that then impacted on that. So we need to respond quickly. I think working with Richard and his team in terms of the food production and distribution arrangements for shielding would be ideal, because we would then be getting the food to the local communities at a ward level, because we can't ask people to move out of their ward to pick up food on a daily basis when the public health advice is clearly to do exactly the opposite. So working with the shielding team and the distribution strategy will be much more effective. I'm confident of that.
Leader, I just wonder if we can get that up, an update, as we get a daily brief, a daily update from Mark Malloy and his team, obviously through Richard, and can we just make sure that kind of information is incorporated into that, please?
Okay, thank you.
Just a practical point, if somebody's delivering free school meals to children, would they require PVG in order to do that?
I would not have thought so. I would not have thought so. It's not regulated work, officially not regulated work. It's not the provision of childcare, so I would have thought.
Okay. Adam.
Just a quick point. I appreciate what we're sort of talking about wards, but for somebody like me who has quite a significantly larger wards than sort of some of the more urban ones, I think, you know, we should be quite clear that, you know, I don't think there's any reason for people to be travelling from Lochmaben to Moffat to deliver these services. I think we should be quite clear on that.
Okay, if we can, thanks very much. Thanks again. Thanks to all the members of your staff and that for delivering all this assistance and clearly having to work under considerable pressure in order to deal with a very rapidly changing situation.
Very much.
Item 4 is supporting communities and tackling poverty. I'm sure we're all very much committed to protecting and caring for vulnerable people across our region, and we have already seen the amazing community response, for which we thank every volunteer and member of staff. Our job as a subcommittee today and in future is to give our 100% support to these activities and to help in whatever way we can. Clearly, we welcome the Scottish Government funding and the recognition for the hardship fund, at least that local authorities are best placed to coordinate local need. The report presented here shows just how swiftly we have identified what the main COVID-19 pressures are for our communities, and so we are still waiting for the detailed guidance from the Scottish Government for the various funds. Approval from the subcommittee today for allocations means that we can get the money out as soon as possible. It is important to note that these initial COVID-19 pressures have been identified in dialogue with community groups, and that is consistent with our approach to this work, where people in localities and in support groups, for example, for disabled people or refugees, are in close communication with people they know and they know what they need. It also proposes that the Council take some measures to alleviate financial pressures on people during this difficult time, suspending burial charge increases, headstone costs, no surcharges no matter what day the burial is on, and not currently pursuing council tax arrears. The report also proposes allocating the majority of our 2020-21 Tackling Poverty Fund to ensure that we are ready to go forward after COVID-19, including community transport, taxi cards and children's clothing grants. Together, all these measures provide a strong start to our support for communities during the current crisis and puts in place some longer-term initiatives to sustain support in the longer term. And Liz Manson is here to speak to the report and to answer any questions. Liz, do you have anything further to say?
Yeah, maybe just to pick up a couple of issues that have been raised in the first item there about the third sector arrangements for coordinating volunteers and requests for support. As you'll see in 3.3, Third Sector Dumfries and Galloway already had a volunteer database arrangement. So what's happened is they have allocated pretty much all their staff to managing that database. And as Richard said earlier, there's over 800 volunteers have registered and we're getting about 100 every day. So they're quickly processing them, and there's a template, if you like, that volunteers are asked to complete, and that does indeed ask how far they're willing to travel. And I think what the third sector then is doing is matching that up with the requests from community groups and others, and that's community councils and other organisations that have resilience plans, particularly in areas where there isn't a community council, and food sharing organisations. And where there's a very clear match, that's been done very quickly. There perhaps the volunteers are being more general in what their support is able to do. There's then a discussion with the groups, or indeed the ward officers are providing some assistance in identifying that match about where we've got a volunteer and where physically they are supporting. And you're absolutely right that the focus is on getting as close as possible to where the volunteer lives and making it as local as possible. So we have obviously offered any additional administrative support that Third Sector D&G wants to do, but at the moment they feel they're processing these applications pretty quickly. And one of the things that the sector has asked us to do is to provide some sort of identification, so that when the volunteers are out doing work, that they have got that sort of accreditation that they can show people. So that's one of the things that we're doing. And also you'll see in the proposals about what we're doing with the money from the Scottish Government, that providing PPE to the volunteers is another area of support, where the SAIL is working with the logistics SAIL, and also about transport and insurance. Your point about PVG, again, where the volunteering role does not require that, that's fine. But in the longer term, the anticipation is that some of the volunteers, we will be developing them into some of the roles to support health and social care particularly. And the NHS SAIL about workforce is certainly working on how we're going to develop our volunteers to do perhaps some more direct support in these areas. And that's where PVG probably would be required. But that's certainly something for the medium term. It's not something that they're dealing with immediately. So I think just to highlight, as the Chair has said, that the proposals that are presented here, particularly for the initial use of the hardship fund, which is the fund that the Council has total discretion on, are in response to the proposals from the third sector, particularly, and in discussion with them. And you'll see at 3.10.2, and we've talked quite a lot this morning about food, that again, that idea about there are some local hotels and cafes and restaurants who are willing to prepare meals, and again, that sort of focuses in on the very keeping it as local as we possibly can, but allowing these local groups to purchase hot meals. And again, it's also about one of the ways that we see supporting local businesses, because they will have stock, they have facilities that can be used in a local way. So the proposal is that if you allocate the monies as set out, just summarised at 3.11 in the report, that is the total that is currently allocated to us for the hardship fund. But I think we can expect that when the information about the food fund, the community resilience fund, and the wellbeing fund, I think some of these things may well fall into these categories, and we would then use these other funds. But what we were keen to do was to try and start getting some of that money out, particularly to community groups, so that they can they know that they've got that funding coming, and to help their sustainability and their ongoing activity. So this is the first report, I think, in terms of allocating funding, but you will see further reports and further allocations as we work through the crisis in the coming weeks. Our method is about, we are channeling this through third sector organisations. So, you know, we already have checked there's governance arrangements, and we've got payment systems set up for them. So again, it can be done quite swiftly, but within the council's requirements for following the public pound. And we're talking about proportionate performance monitoring. So clearly you do need to know what the organisations have done with the funding, but clearly we're not going to be placing an unnecessary burden on them. So that's the first issue then about the council funding, about the Scottish Government funding. And again, as the Chair said in her introduction, we have a number of, a couple of suggestions about other council assistance, which is around fees for burials, memorial stones, and surcharges, and also about suspending council tax recovery. So I'll perhaps pause there, and then we'll come back to the council allocation if it's poverty fund, if that's okay, just looking at the COVID issues.
So any questions on the Scottish Government funding, Ronnie and Adam? Anybody, Ian? Anybody else? Stephen? Rob?
Yes, please.
Jane? Okay, thank you. That was right, Ronnie, Ian, I think you have Stephen, Rob and Jane. Okay, Ron?
It's just actually relates to the last question that Ian asked on the free school meals and how people aren't taking it up. Is there any correlation between what's happening now with the voluntary organisations, because families won't be getting food parcels, they won't be getting hot meals, they won't be getting others, so they may be needing that, and if there is a correlation with that, then maybe the schools could help us coming together on that. The other thing is that in 3.10.1 in the housing and homelessness, I see that there's D&G HP, they're looking at voids in the housing to plug a gap, but there's loads and loads of housing that they have. They're actually empty houses just now, the flats up Lochside, there's with maybe one person in a block or something like that. So obviously these flats could be used with very little to do to them. So might be that. Another thing is that in 3.17, I think it is, there's a tackling poverty and period poverty, and that, what's happening with that, and you know, are people getting the products that they need from seeing as how the schools are shut, for example. I don't know how these things are distributed out, and what's happening with that.
Okay. Thank you. With regard to the free school meals, yes, I think that's a fair point. That is something that they would need to look at. Certainly the holiday hunger allocations that have been made for the Easter holidays, the discussions taking place with the organisations that got the funding is clearly we need to look at what the model is, because the applications were predicated on activities as well as food, but clearly there are no activities. So the discussions taking place with them and again the logistics team are about just how we use these funding awards to make sure that we're providing food to children who are eligible, but there is no duplication, that we're tailoring that. So yes, I can certainly raise that specific point with the team. I think the point about DGHP and about bringing any properties back into use as much as possible, again, we can certainly raise that with them. And in terms of the period poverty, one of the arrangements of the community groups is it's not just about food, it's wider supplies, and that certainly, again, Richard touched on that about the shielding arrangements. So yes, I think period products are very much part of that, as well as medicines and prescriptions. So again, that's been picked up in that wider delivery arrangements of community groups.
Tyler?
I think you know, it's really good to have this so quickly to get this money out to those who need it, and particularly the allocations to reduce the burden on local people at this time. I think I'd be quite keen to know sort of when this money gets allocated and when it does get distributed, maybe through that daily brief, just so we know. I'm sure that all of us are having local groups who are concerned about sort of future funding and whether they're going to be viable over the next couple of months. But at the same time, a lot of those local groups are probably the ones that will benefit from this funding, because they're the ones that are in our communities and are distributing supplies and picking up a lot of this work. So I think it'd be useful for us just to know that maybe as each stream is distributed, or the distribution method is known and decided, that can be communicated in that delivery would be more useful.
Any response?
No, that's great.
Okay, Ian.
Thank you, Leader. In general terms, certainly agree with the recommendations. When it comes to the welfare fund and the hardship fund, I just wondered how much flexibility is in regards to that, because obviously we want to make sure that this money is spent in the right places, Liz. So it's a really good report. You've obviously done a lot of work on it. There's been a lot of thought going into this. But just what reassurances around the fact that this money can be spent in the right ways, and it hits the ground as quick as we can, so we can see things happening.
Yeah, the council has complete discretion over the hardship fund. We don't know yet any criteria or what amount would come to council, or it's going direct to third sector organisations for the other funds that are listed in the appendix. So I think what we were keen to do is to get some of this money out using the hardship fund allocation in the first instance, and then if we need to do an accounting change and say, for example, the food fund, if we have an allocation from that, then we'll move the food issues out of the hardship fund, take that out of the food fund, and then you will have flexibility about what you do next with the hardship fund. I think we were keen just to start getting support to some of these third sector groups without waiting for the criteria for all of the funds.
Thank you.
Okay. Stephen. I think you're
Stephen.
Still muted.
Oh, sorry, is that better?
Yeah, that's better, yeah.
Sorry about that. Yeah, thanks, Leader. It's just Appendix 3, it's on a similar point there. Just obviously there's additional funding details to be confirmed or advised, some of which tallies with the kind of funding we're looking to use at the moment. So it looks like, based on the sort of roughly 3% distribution, that could be another 5 to 6 million coming to the region, whether through ourselves or through third sector or security. Is that what we're anticipating, and is that why, Liz, we've sort of set it up in such a way that we're effectively setting out on this path, and these funds, when they come in, will effectively bolster the directions we've taken to support the people in need?
Yes, that's right. We don't know at the moment what our allocation would be, or indeed if that money will be coming to the council. So, but I think we can be confident that there will be something that we have some allocation for. I'm afraid we don't have any more details at the moment.
Okay, and just on, obviously, I mean, the key thing today is about brigading agencies, services, working together, key partnership arrangements. So in a sense, at this time particularly, it's that the benefit comes to the region rather than necessarily to us, because we'll be working with our partners to make sure we're getting the best value for all the money that comes to the region, I'm hoping.
Yes, I think that's a very good point.
Thank you.
Rob? I think your mic's not on.
I've got it this time. You have to press it twice, and I'm pressing it once. Apologies for that. I think it's a good report. I support the recommendations. And Liz, thanks also for picking up on some of the things that had been fed back in terms of questions, a lot of which I think were from the SNP group. Just a couple of things, that apologies if they have been covered somewhere and I've missed them. It was firstly in relation to the allocations recommended for food at 3.10.2. And one of the points that we had, I'm not sure if it can be answered yet, was a question over how this might work if you have cafe and hotel staff that are not working in order to get the 80% wage subsidy. Because I guess the risk would be that in order to assist us, we might not be putting enough work their way for them to come back, full time, if you see what I mean. And they might end up in maybe a rather tricky situation. I'm not sure if it can be answered at this point, as I say, but wanted to flag it up. And the second one, and my apologies if this is for the next set of recommendations, although I'm not sure that it is, was whether we're considering any extra support for the various women's aid organisations, etc., across the region, just because with all of the additional social pressures that are going on in terms of people being crammed in together, there might be an additional need there. I don't know if that's been factored in, and if this is not the appropriate point for that, then my apologies. That's the questions from me. Thank you.
Yeah, certainly your first point about the relationship between supporting communities and supporting business, I think that's one that we'll certainly be picking up over the coming days. With regard to support for women's aid, you'll see one of the funding streams is about support for charities and other organisations that are supporting people who are vulnerable, and I would think that women's aid organisations would certainly fall into that category. Again, whether or not that comes to the council for distribution or whether it's going direct to being distributed through other mechanisms, we don't know that yet, but I think that's a very good point about women's aid organisations. We'll certainly pick that one up.
Thank you. Jane?
I'm unmuted, I think. Is that okay?
That's it, I can hear you.
Great. This was with respect to a question about ward information held by our partner agencies, Leader. The question is really whether these are sufficiently nuanced to identify individual families, because after all, 80% of these income-deprived families don't live in SIMDs, and I just wanted to be absolutely clear that we would be spreading this appropriately across all the wards.
I think that the issue that Gillian Bryson referenced earlier on about connecting up the children who are entitled to free school meals with the shielding, and making sure that we actually know which children in which communities we need to get support to. I think that's a key part of that, but certainly the fair share organisations and the organisations who are already supporting people in poverty will have a number of people who have been referred to them by social work or other referral routes. So yes, there is a connection being made just to make sure that we're clear that the children who are most in need are getting supplies. And I think also just to pick up that the secondary school hubs have got other supplies, including period products, that they will be making sure that these children are getting whatever it is that they need. One of the things, if it's not already come to elected members, will be coming shortly, is the list of community groups that are operating in each ward. And some of that will be, you know, if you know of anything else in your area that needs to be added to that list, that would be helpful. But again, it allows you to know what groups there are in your area, if should people support you, that you can also refer them.
Yeah, I think that would be helpful actually.
Yes,
we could have that. We can see that. I just had one little question about the fair share, because we discussed prior to all this happening support for the groups which currently operated fair share. I think there was only about 3 of them at that point. So do we have another dozen across the region who are who want to take part?
We have a number who fair share works through a registration process. So one of the things that we're proposing here is that we pay the subscriptions to fair share. So that they get access to these products. There are also conversations taking place with the local supermarkets as well, who do provide support to some of our food sharing community groups. So when you combine that with the national procurement arrangements we were talking about earlier, and the logistics team working with local businesses, what we're trying to do is just to maximise the amount of stock and products that these groups have available to them to distribute.
Thank you. Simon.
It's looking to the future. We're told that we're going to have a bigger problem maybe in a couple of months' time. We're talking about getting the money out there, but we don't want to run out if, you know, what needs to be out needs to be out. We heard earlier that we might be duplicating certain things with regard to free school meals and people who are requiring the food boxes. They might be picking up on that. Are you doing something to collate that? And is there all the money that is available and going out? There's no projects that are sort of needing lead-in time whereby you're 2 months into the year before you've actually delivered the project. You know, it's able to, the projects are able to go straight away.
And I think that's the point about when we get other funding streams, that you will then be able to look at what's the next step, and perhaps moving on to the council poverty funding, that we're recommending to you that you would maybe keep about 1/3 of that, so that you can look at that later in the year and then decide what still needs to be done, what needs to be done in the longer term. So I think that's a really helpful just acknowledgement about we need to sort some things just now, but there is going to be a medium and long term implication of this.
Okay, unless you wanted then to talk separately about the council funding.
Yes, so if you're comfortable with the approach for the hardship fund and how we will bring forward future reports to you about the use of the other funding streams as we get the details. So moving into the council anti-poverty money, in your budget you set aside a figure for this financial year, and also because of some of the other funding streams that became available for funding, you have 436,000 of roll forward funding. So we're suggesting to you that you would allocate some of that, and it's summarised in 3.21, to some of these issues which are going to be longer term, but that you maintain 360,000, about 1/3 of that money, to look at later in the year once we've got a more up-to-date picture of the long-term implications of this.
Any questions on? Any questions on the remote colleagues? Okay, great. I had one, I suppose it's about community transport, because we had been discussing that in the context of the budget, and the NHS had been brought to the table at the Community Planning Partnership Board to make a contribution towards community transport. So first of all, have we actually got a definite commitment from the NHS to make their contribution towards it? And the other thing was that the sum that we did talk about was actually 45k rather than 40k.
I can say I don't know the position, but I can certainly get transport colleagues to give you an update about whether or not the NHS has invested their money. But if you want to make that 45 and make it 355 that you're keeping.
Well, the chair of the health board did say he had a commitment to doing it, so I think it's just worth chasing that up because we're thinking about other things at the moment. Okay, are we happy to go on to the recommendations?
Okay. Just on the back of what you've said there, so say just for one of the reasons I asked about flexibility, just say for some reason the pressures that NHS are under are so significant that they can't contribute, is there enough flexibility within our budget, the council's budget, we can make that happen? Because I think you're absolutely right, this transport issue has to be addressed and be fully funded.
Yeah.
Okay, well certainly we could bring you an update in the future.
Thanks.
Okay,
thank you.
So we've been asked to note the work, first of all to note 1 and 5, but also to agree 2, which is the approach to the use of the Scottish Government funds. Is that agreed? To agree to the other measures relating to burials and council tax, and to agree the allocation of the 1.066 million council funding as set out in paragraph 3.19 and 3.2, although we say community transport will be 45. Lovely. Thanks very much.
Thank you.
Okay, if we can flip the page here. There we are. Item 5 is the COVID-19 business support, which is a report by the head of economy and planning. Again, we welcome the UK and Scottish Government funding and the recognition of the key role that local authorities have to play in supporting private businesses and social enterprises. These are fundamental to the prosperity of our society, and we must do everything that we can to help them deal with this crisis. The introduction of a new enterprise agency next week for our area is both an opportunity and a challenge, but there are also already good established links with the new body and a commitment of all to make the changeover work efficiently and effectively and smoothly, and to focus on the needs of our local business people. The report presented here again shows the speed and responsiveness of our council officers to get information and support in place about the government grants. The number of inquiries so far was 385 in the first 48 hours, and that evidences just how important that is. We've also been struck, however, by 3.2.6, which highlights that a large number of local businesses will not be eligible for the national awards. It's therefore even more important that our council takes whatever measures we can to assist these other businesses, including our roles as major customer, as landlord and as commissioner. This is clearly a fast-moving and dynamic situation, and there's a number of issues, and we are to receive an update from Steve on this issue. Over to you, Steve.
Morning. Thank you, Chair. So yes, it seems like a long time since I gave that update to full council last Friday. It also seems like a long time since this report was written and circulated. So there's a few points of update, if that's okay, Chair, just to give. I think I've flagged up in the report that I would give a verbal update in a few areas. So obviously the first update to give in terms of the government support package, as everybody will be aware, is the scheme for the self-employed has now been announced. We're just still digesting some of the detail of that, and we'll get that detail up onto our web pages as soon as we can, but essentially they've launched their coronavirus self-employment income support scheme, which the government is saying they estimate will cover around 95% of people who earn a living mainly from self-employment, based on a payment covering up to 80% of average profits, up to a maximum of £2,500 a month, and that would be backdated to March but not paid until June, and the whole scheme is being administered through HMRC. So that's the first update. Clearly self-employment was coming through as a major concern and issue. The second update that we committed to provide in the report, I think we mentioned paragraph 3.2.3, that I would give an update on further contacts and activity, in particular in connection with the actions that we've put in place around having a dedicated local helpline for businesses and an associated email address. Those were part of our early action plan that we've been developing and implementing over this first week of the emergency planning arrangements. The helpline, as I say, has now been put in place, and I can give you a quick update on the inquiries that we've dealt with. It's been extremely busy. We've pulled additional staff in to help resource it, so we've had a team of 16 folk handling these inquiries. And during the week, and we've extended out the opening hours of that helpline so it now runs 8 a.m. till 8 p.m, 12 hours a day. So during the first 4 days, we had 584 phone inquiries and 236 email inquiries. Just to give you a flavour of the issues that were getting raised through those communications. So there were really three main issues, together with a number of others, but the three standout ones were self-employment, cash flow, and staffing issues. So those were the key things that were coming out. We're doing an analysis, and we'll have a more detailed analysis of that at some point. We're capturing all of the issues that businesses have been raising with us. So the other element that we've put in place very rapidly this week has been the mechanism for distributing the small business grant scheme to local companies. So that was announced, as you'll be aware, by government on Tuesday. They announced that it would be going live on Wednesday. So on Wednesday, we put our application form and associated guidance on our website and started then to receive applications. We managed to get the first payments to local businesses processed within 24 hours of the scheme going live. So we've actually got 10 applications approved and payments out to local businesses. And I'll give you a quick update just to give you an idea of the volume of traffic that has generated. I just got an update this morning to say that as of close of play last night, we had 653 applications that have been basically taken into processing through the website, with a further 320 sitting waiting to be downloaded and input to the system. So it looks like we've had really getting on for 1,000 applications just in those first few days. Of the 653 that are now in the system, just to give you an idea of the breakdown, 514 of those applications are for the small grant scheme. So that's the 10K scheme. And 46 of those applications are for the 25K totally at those specific 3 sectors. Interestingly, and I'll come on to this, another useful piece of information to come out of that process is that at the moment 93 of those are not eligible for support. So we'll be using that to kind of gather up information and evidence in terms of what businesses are actually missing out on the support, and I'll come back to that in a minute. So that's really where we are with the grant scheme, and we've worked closely with our kind of partner organisations, in particular the Chamber of Commerce and the Economic Leadership Group, to kind of disseminate that information and get it out to the local business community as quickly as possible. So the third area I think that we said that we would give a quick update on is around that point about engagement with partner organisations. So I think in paragraph 3.2.7 in the report, we mentioned that there had been initial engagement with our partners, South of Scotland Enterprise and Scottish Borders Council, at both political and operational level, really with a view to developing some kind of shared response to the economic crisis. And we've now had an initial political level meeting. Councillor Rob Davidson met with his counterpart from Scottish Borders, and also with the chair of the agency just yesterday afternoon, I think it was, Rob, wasn't it? I don't know if you wanted to add anything more, but we've certainly had a positive reaction, or positive reception to the approach that we've made to try to develop a kind of coordinated partnership response to this. In particular, once we get past this very initial kind of emergency response, the first priority has to be to distribute that Scottish Government grant assistance to those businesses that need it. But once we get through that initial emergency response, we have to then start thinking about what about the businesses that are missing out, because that net doesn't catch them. And also we need to be starting to think about a longer term recovery plan, because this crisis is having a big impact, and it will have a big impact both nationally and locally on the economy and on our businesses and on their staff. So we need to really start thinking ahead to developing a longer term recovery plan that we can start to put in place with our partner agencies. Thanks, Chair.
Thank you. Rob, did you want to say anything about your meeting with Mark Rowley and Russell Briggs yesterday?
If I could please, Leader, yes. Everything is of course moving very quickly, but it was a positive, I think, starting point. All 3 parties, I think, were clearly in agreement that we need a joined up approach. Our 3 organisations will do better if we're working together on the medium and long term response to the crisis as it's developing. I think in very broad outline terms, as Steve said, that I think we'll look at the gaps in support as they're becoming clearer to us, and potentially how some of the impacts on business actually unfold over the next few weeks. It may be that at this point we're businesses that are not terribly concerned about surviving and getting through the immediate situation, but actually become much more concerned as things develop, whether it might be order books go up or all sorts of different reasons. I think it's also fairly clear that there will probably continue to be gaps in the government provision, and I think that although we can't possibly have had the chance to scope it out yet, the fact that self-employed people will need to wait until June may be another problem that we have to try and get a grip on. But certainly in terms of a tripartite response to the medium and longer term consequences of this, there is agreement across the piece that we need to be doing that. It needs to be done on that basis. It's a collaborative approach between the two councils and the new agency. We'll both bring different things to the table. The on the ground response that we can provide in direct engagement with business versus the agency's maybe more limited staff capability but substantial resources. I think that those can be combined quite effectively to look at what we need to be doing next, in addition to getting the grant support out the door. Can I also just say, Leader, if you indulge me, a big thank you to the teams who made a start on this, because they started turning around grants within 24 hours. As Steve has said, I think that's a really good effort. And if anything, they're ramping that up and increasing that pace, which I think is really, really good under the circumstances, and they ought to be congratulated for that.
Thanks. Ronnie and Adam. Malcolm?
Yeah. Okay.
Anybody else remotely who wants to ask a question? Okay, Ronnie.
Well, just on Rob's point, maybe it's on the self-employed workers, and obviously things have changed very quickly on that. And one of the things that Steve was saying is mainly the big issues are cash flow. And if you have to wait 3 months for cash, obviously that's got to have an impact on these self-employed businesses. And is there any way, that some kind of funding could be set up, maybe a loan scheme, 0% or something like that, for a particular length of time, guarantees to keep these people, afloat until they actually get some money in?
Chair, yeah, there are loan schemes which self-employed can apply for that have already been put in place through the banks. So I think the intention of the understanding of government is that those loan schemes would be able to provide that cash flow and income support for self-employed people until such time as HMRC are able to issue the grant payments to them, either that and or a combination of overdraft facilities. I think that's the expectation of government.
My question was not about the schemes, but it's very difficult to access just now for some banks as well. But it's at 0%. The businesses we're looking for, they won't want to gather up debt where they would have future cash flow problems. It's something, I don't know whether it's something the council could facilitate for a number, whether there's any mechanisms or other mechanisms through the Scottish Government or whoever it might be that we could access. I don't know, but I think small businesses need that kind of security, if you want, to make them viable in the future.
I know Gail McGregor said that there was an issue being discussed at COSLA about state aid with regard to councils being able to do that. But there was something set up. During Foot and Mouth, there was a loan scheme, and I think it was set up through Scottish Enterprise, where there was sort of a small business loan scheme, which went back in again. So I just wondered whether there's something that's been done before that might be a model to this.
There are small business loan schemes in existence at the moment, but I think what you're talking about is something quite specific for this set of circumstances. So we'll certainly take that away and feed it into our discussions with the enterprise company around looking at what other supports are going to be needed once we've got a firm handle on what does the government schemes cover and where are those gaps. I don't think that'll become completely apparent for a few weeks yet, but we will take a look at the self-employed situation as well as the gaps in terms of the grant scheme.
I think just adding on to Lonnie's point, I think that the issue is that it's not certainly not anybody in this room's fault, but the problem for businesses is that uncertainty, because and unfortunately I've been privy to too many conversations of some businesses who are just thinking of shutting up shop, and you know, by whatever means, over the next couple of weeks, because first of all, they don't know, even through the job retention scheme, exactly when they will get that money. Obviously the self-employed scheme is good, but the delay in getting it until June. And again, for some of the larger businesses or some of the businesses that have a huge number of resources, who are still going to have to incur those costs over the next 3 months, even though they're not going to make anything, is scary. And quite understandably, there's a number of them who are thinking it would be cheaper to shut up shop, and it would be, you know, the chance of them being sustainable in the long term is reduced. But I think that's why I'm very keen that we look at this urgently. I'm very keen that we do look at if there's something that we can do locally here, whether that is a 0% loan through whatever body, to try and just help businesses to meet those costs. You know, for some businesses, 70% of them will be paid through the schemes that are available nationally. But if we want to have these businesses here in 3 months' time, then we are going to have to look at additional support. In saying that, I do appreciate the other mechanisms that we've got in here to try and support businesses locally, such as rent holidays for where we are a landlord. I think that's very welcome and something we should be proud of, and it's a good range of measures there, both nationally and locally, that we're looking at. One thing I did want to raise, though, is that there are a small number of businesses locally who are distributing foodstuffs, particularly dairy products locally, who have seen a huge increase in demand, quite understandably. And you know those businesses, I view, are integral into keeping people in their homes while delivering foodstuffs, particularly dairy products, to them. I've put in a business have contacted me, and I've put in an inquiry, and I've got to say I was slightly disappointed that there didn't seem to be the sort of urgency placed on that. It was a business who has got a backlog of 400 inquiries, is dealing with about 70 inquiries a day, urgently needs an electrician, urgently needs admin support, and urgently needs a cash flow loan of any description, just to help them see through the next 4 weeks until they start to get some of their invoices in from customers. That might have been picked up in the last couple of days, because I think it was near the start of the week. But you know, for me, for some of these businesses that are helping to keep people in their home, first of all, but secondly, are able to distribute food, that this council should essentially be account managing them, because of the role that they're going to play, not just in providing foodstuffs, but by helping to reinforce and enact those public health messages. And for me, certainly the business that's came to me, it's quite clear that if they get these 3 things, that they are absolutely able to manage, and there'll be very little for the council that we would need to do. But I think it's essential that these businesses are supported, because they're dealing with unprecedented levels of demand that they simply cannot cope at the moment. They know exactly what they need, but they're struggling to find it, because I mean, they need an electrician, but all the electricians have closed unless it's an essential life or death situation. And I think that we as a council need to try and help those specific companies as much as possible. I think there's a handful of them in the region, but if we can help them now, then they might be able to help us keep another 100, 200, 300 people in their homes over the next 3 months, and particularly help to deliver to those vulnerable people.
Chair, yeah, I mean, I think it's a good point that we shouldn't forget that there are some businesses in this situation that actually have got the opposite problem. Absolutely. In that they are struggling to keep up with demand. And as you say, those businesses are going to be key to future economic recovery. So yeah, we do have to continue to provide help and support to them through Business Gateway. And without going into any details, I'm aware of the case that you've raised, and I know that there has been contact with the company and some advice and support has been offered in terms of the recruitment issues that they were having. So we are dealing with that. What I would say is that this week has been an exceptional week, in that it has literally been all hands on deck in terms of, first of all, manning that helpline that was set up, and secondly, putting in place the small grant scheme, so that we can get that cash out to local businesses as quickly as we possibly can. We've been successful in achieving that. I think we're among the councils in Scotland to get that money into businesses' bank accounts. But yes, I mean, what you're saying is correct, and we won't take our eye off that ball.
Malcolm?
Thank you. It was, first of all, just to congratulate Steve and his team on the work they've done pulling this together so quickly. It was a good report, and I've been quite impressed with the speed that this has been carried out. And again, just to support both Ronnie and Adam, I think the reality for a lot of businesses out there is the cash flow pressures are going to be immense. They've got a lot of people are facing zero cash inflows at the minute. They're going to have to fund the 80% furlough thing for wages because they don't know when they're going to get the money back, what the mechanism is going to be. They've then got to wait till June until they now get payments if they're self-employed. And there's another group of businesses in the region who seem to fall between the cracks a bit. I was pleased when I saw the list of potentially eligible businesses for the £25,000 grant, because it takes cognizance of the fact that although a business might not be directly involved in retail, hospitality and leisure, that supports an awful lot of other businesses in the region. And I think that you have taken cognizance of that, and that guidance is very good. But we do have a number of particularly hotel businesses who are just north of the £51,000 for rates relief. And that's a bit of a cliff edge. So I wondered if there was any kind of support potentially coming forward for them, really, because a lot of these people have invested a lot of money in the last year or so, and they're going to be struggling to pay it back. So is there any thought being taken to that?
Yes, Chair. Yeah, thank you, Malcolm. As you say, one of the drawbacks with the scheme as it has been devised by government is that there is a cliff edge, and we have already fed that back through COSLA to Scottish Government. The scheme obviously was put together at a fair rate of knots. We're in the middle of an emergency situation, so it won't be perfect. Government, I think, wanted to find a quick way of trying to get support and help out to businesses. I think there is a recognition that it's not perfect, and they have sent a message to say, basically, can we continue to feed back to them as we start to deal with these grants? Can we continue to feed back to them where the issues and problems are? And that's certainly that existence of a cliff edge, rather than what we fed back to them was, would it not be better to have a tapering down of support rather than this business of you either get 100% of the support or you get nothing? So that's one of the points we fed back very strongly to them. And I think as well, this will be one of the strengths of developing a joint approach between ourselves, the new agency and Scottish Borders. In one of the key points that was discussed the other day was the value and the strength of jointly lobbying and feeding these points back to government. I think the agency itself clearly has a direct line into cabinet ministers. And so for us, that could be quite a good route for us to get some of those key messages fed back to government.
Shall we move to the recommendations? Oh, sorry.
Sorry. Just one thing on the 3.31. I think it was Adam that mentioned about the landlord's rent holiday. Just to say, it's not just. It's industrial people that we rent to. There are other groups that we rent, that we gather rent from our properties. Some charitable organisations, for example. I think they're in the same boat. If you want, we looked at that.
Happy to take that away, Ronnie. So we picked up in terms of business in this report, but we'll pick up that in terms of other properties that either rent or lease.
Thank you.
Bring that back.
Ian.
Thanks, Leader. So I suppose just my queries in regards to the questions that have been asked, just when do we get the update? So especially when about self-employed, and that gap has been announced. One other thing that hasn't been spoken about, Councillor Tate and myself in the east of the region have been contacted by wind farm developer Steve. Hopefully this it's yourself kind of pointing this out in regards to, they're saying, listen, we're quite keen to get involved, make a contribution, financial or otherwise, in regards to whether it's a community setting or an economic setting. How do we help as an organisation stroke company? How do we get into that and help support the council in its desires to try and obviously react to COVID-19 in particular? So just guidance in regards to that is, should I be putting them straight in touch with you with likes of that? It's the only thing I think has to be covered today, but everything else I do think we need to particularly focus on the self-employed people and how we keep local businesses through their appropriate procurement process, grant schemes, loans, so on and so forth, that we make sure we keep them afloat.
Okay, yeah, well, if you could put them in touch with me, Ian, that would be very welcome. That might give us a starting point for having a loan fund. So we'll certainly have a look at that.
Excellent.
Steve
I'll do that today. Oh, sorry.
Steve mentioned it was 93 companies who had put in an application weren't eligible. What are the sort of reasons for that? Is it the size criteria? Are we getting back to them fairly quick on that as well? Because I think a lot of people expect that they'll just fill the forms and get the response back, the money will be on its way, sort of thing. I know that I've seen some of the information coming back the way, and I think it's been laid out very well, and it's been quite understandable, because sometimes things that do come through aren't they're in sort of business speak, and some of the people who are in these businesses are maybe just starting out and haven't had the experience, and I think you're doing a good job there to guide people in a way that they can understand, so that's been appreciated. I've heard that.
Okay, thanks, Chair. I don't have the detail at the moment. I've only just this morning had that figure of 93, but we will be doing an analysis of it, because I think it is really important that we understand the reasons that businesses are not eligible, so that we can then start to feed that into the thinking around what might we do in terms of some supplementary programme of support. So we will be doing that analysis, so I can update future meetings.
Yeah, just going on the self-employed again. Obviously, you haven't got a lot of detail, and you just got the announcement yesterday. But it's self-employed with up to £50,000 trading profit. There'll be firms out there with £51,000, and maybe outside it, or just slightly outside it. And I think we need to try and find other ways to maybe look at helping them and see how many they are.
Yeah, no, that's a good point as well. There is again a cliff edge limit in terms of the support to self-employment.
Yeah.
Okay, shall we move to the recommendations? We're being asked to note 1 and 2. Are we happy with that?
Leader, sorry, I don't know if you're able to see me on the screen there, but
No, I'm not sorry, Stephen. I can't
see you.
There's a strange moniker, but
okay. It was just a quick one, just on possibly the 93 firms. I've had inquiry about companies that don't fall into the non-domestic rates because they rent their premises from a charity, so they fall within a sort of an exclusion, if you like, so they wouldn't be eligible for that. But it's effectively the same sort of boat. It's just that there's a kind of exemption for charities who rent out spaces. Is that picked up from the 93 that haven't been awarded to date?
Chair, thank you, Stephen. As I said, I don't know the detail of why those 93 are not eligible at this point in time. But if that is one of the factors, then we will pick that up and look at it as part of our considerations of looking at a supplementary support programme.
okay, right. Okay, so if we go to the recommendations, we were asked to note 1 and 2. We noted that to support the actions to accelerate eligible grants. Yep. To note 4, to support the action being taken to develop further support and interventions for local businesses working with the South of Scotland Enterprise Agency and Scottish Borders Council. note 6, 7 and agree for the council-owned industrial property portfolio for a rent holiday be given to our tenants, bearing in mind there was also the issue about other organisations other than businesses which may require support, but
we'll bring more information back to members next week.
I think, just on the previous one, the 3-month wait, and examining some ways about loan schemes and other.
Yes, so we're ready to look in, to investigate the opportunities for loan schemes. Ian?
Apologies, I should have picked this up. So we've agreed the recommendation. But see at 3.2.5, it says the grant scheme announced by Scottish Government with the £1.2 billion funding is open on the 1st of April and will run to the 31st of March 2021. So I take it that is a bit of a typo or something. I meant to say that earlier, sorry, leader. 2.5, and it's the first sentence at the top.
2.5.
The grant
31st of March 2021.
Yeah.
Sorry, that's right. So it's for a year. That's right.
It's for a year.
It's for a year. Spot on. Excellent. I know. I thought it was right. Sorry, that's been clarity. Thank you very much for the ignorance.
Okay. Item 6 is the interim arrangements for licensing decisions. It's a report by the Community Planning and Engagement Manager. It's to advise members of the interim decision-making arrangements that licensing services has put in place to deal with both civic government and alcohol licensing applications and related issues during the pandemic and social distancing requirements, and an impending hearing which has to be held by this subcommittee by the 1st of May. And I think again, Liz is come here to answer any questions. Liz, is there anything further you want to say about the licensing issue?
No, I think hopefully it's fairly straightforward for you all.
Any questions about the licensing? Ivan.
Just one. If we are actually sending staff out, if there are licensing issues, if they're sole working, have we any health and safety sort of advice for them, you know, because you've got social distancing, you can't put 2 in a car to go and do a job, there might be 1 to go and do enforcement. How are we making sure that that person is safe? Because, well, mental stress just now for businesses, etc., will be high. So you're putting yourself in a possibly difficult situation.
And the arrangements that have been put in place for all staff in terms of safe working practices will apply to the licensing standards officers in the same way that they do for other community safety staff, etc.
Any other questions?
Elaine, yes.
Yeah. Jane.
Somewhere, somebody said something along the lines that decisions would be taken forward in discussions with the licensing board chairs.
Yeah, that was suggested actually by one of the members of the Labour group, but actually we can't take any decisions on the basis of on behalf of the licensing boards. It's just the licensing panel that we can do. So I'd be going to say that, and then I noticed 3.1, so I thought I'm not going to say that then. One point you said that there has to be this hearing with regard to possible suspension of a taxi driver's licence. Would that be a separate meeting of this committee, just dealing with that particular point? Bit of business.
It can just be part of your agenda, but it will need to be a confidential item. So we would do the normal practice. It would be the last item on your agenda.
Because obviously there's an issue about training that the people who were involved in that hearing would have to have undergone the appropriate training. So I think that's one of the things.
Again, because it's the panel, no, you don't need to have training. It's
right, okay, it's just not
the boards, and it's that distinction between the boards, which are quasi judicial decision-making body, and the panel. So you're all okay in terms of that aspect.
Okay, I'm happy to note 1, 2 and 3.
Agreed.
Thank you. Item 7 is another similar issue, is interim arrangements for planning decisions. And support by the head of economy and planning. Members are asked to consider temporarily amending the scheme of delegation to planning officers during the COVID-19 pandemic to allow officers to determine planning and related applications, except for those applications which statutorily require a committee decision, and that these applications should be determined by the subcommittee, noting that there are currently no items of business scheduled for the local review body for the coming months. And Steve is here to assist members. Steve.
Nothing really to add to the report, Chair, thanks.
Any questions? Ian, I think you had a question, didn't you?
I did, Leader. Thanks very much for letting me in. So I felt when I read this, I wasn't absolutely clear when it regards to the statutory, because when I read through the report, I felt that it didn't apply to statutory, doesn't apply to, say, member calling or that type of, or the 6 objections, obviously. So that would be taken away. I did feel that there was and with discussion with the group that is as well, that there's a hybrid in regards to recommendation 2 that we could possibly agree. But I just see when it comes to temporary amend the scheme of delegation to delegate all plan decisions which do not require a committee decision in law to appointed officers and plan services, all statutory decisions not requiring a plan determination here made by the subcommittee. So what does that mean, Steve, in real terms, putting that into context? So we haven't, because there is that, I think it's any full council decisions is what it's really saying. So what does that really mean? And I'll come back with a proposal in regards to hybrid.
Okay, well, thank you, Chair. If I may, so there are only certain categories of application that require a committee decision by law, basically. And those are set out, I think, in paragraph 3.2. So basically that is applications which are designated as national applications, of which we get once in a blue moon. I think we've only ever had 2. Or major developments which are significantly contrary to the development plan. And again, we do not get very many of those at all. The only other category that would fit into this statutory definition are applications that are submitted by the council. So we're not allowed legally to determine our own planning applications under delegated powers. So they would have to come to, they would require a committee decision. And what we're also suggesting is, because of code of conduct issues, so to avoid creating legal issues, we're also suggesting that any applications made by members or officers related to the planning process should continue to come to committee. So it's really those 4 categories.
So I suppose, taking that into consideration, and the only thing I would like to add to that, I do think that members should still have a right to call in. And if we were then to determine an application at an ad hoc committee, we would remove the right for speaking, public speaking, just for the sake of expediency and get on with decisions. It's the only difference. When I read that, in order to prevent the code of conduct for members of the professional officers, it is best practice to require any application. I just thought that was a wee bit light, so we're absolutely clear within the recommendations. I think it's right, any member who's got a contact or a personal application themselves, it should come to committee. Council should decide that, and that's out with your statutory responsibilities is the same. But absolutely, I do think if a particular issue arises within your own ward for any of the ward members, they should still have that right. The only other question, so I would propose that we agree to the scheme, but subject to we cannot say subject to members calling, still determine an application, but that would be still have the removal of any public speaking. It would only be the committee would have the chance to talk, if that's fair enough. I just wonder what the workload is. No detail in regards to the workload, because I'm speaking to construction companies across the board and they're saying, listen, we're shutting down anyways. That's private and RSLs. We're closing for the duration. Now, I know they're working on sites where I've already got permissions, but I just thought over the next 4 to 8 weeks, because it is an emphasis on the impact it'll have on the local economy if these decisions have to come to committee. So that didn't really resonate with me, Steve, being honest, with what I'm hearing from the construction sector, civil engineering as well for that matter. But I just wonder what other members think as well in regards to that small amendment to option 2.
Can I ask what other members would think about that, Ronnie?
Yeah. What we're trying to do here is streamline things to have less, meetings about things. So I think what's on and option 2, as it is the best way forward. I don't think we should try and complicate things too much, because every single member could then start calling in every application that they want. So I think, just for streamlining cases, that they get the planning permission for people as quickly as possible. I think option 2 is the best.
Jane? Yeah, Jane?
Well, I actually take the opposite view. I think that I rather agree with Ian on this one. I think it's probably the case that this will begin to slow down. I quite agree with you. And the numbers of call-ins actually is very small. I do think that we should attempt to maintain transparency, actually, for the public as much as we possibly can. And this is one of the ways in which we can, without, I think, undue pressure. If it changes, if it turns out that everything is being taken in, well, I think we should reconsider. But at this particular point, I am with Councillor Carruthers on this one. I would agree that.
Okay. Adam?
I think, to be honest, I agree with what Councillor Nicholson said. I'm not expecting us to be sitting around this table for months and months and months. We're talking about a change for, what I'm hoping is a maximum of about 3 months. And I think that, many of us are hoping for less time, but, in that time, as Ian has said, the construction industry is shutting up shop for temporarily. So I think that the workload will decrease of planning officers. And actually, we need to focus on what is, the priority of the region at the moment. And I would move that we proceed with the option 2.
Can I ask Stephen or Rob or Malcolm, do you have any views?
Well,
Sorry.
I must admit, I think it's a problem that will largely take care of itself, to be quite honest, because the applications are going to drop back. But I do think it's a bit, it's making it a bit more opaque, exactly as Jane said. I think an option, or even an option to call in at a later date or postpone it so that you can call it in subsequently, I think that might be a possible answer.
I don't have a sort of issue with regard to if it's actually up for refusal, because a refusal then has the right of appeal.
Mm.
But public do not have, if there's an issue that you want to bring in because you want to see it put out clearly, if it's one that's up for approval but there's a lot of public against it, they have no right of appeal. And I think that's maybe where we have an issue, where a member calling may be more appropriate at that time, whereas if it was, to me, if it's up for refusal, you have your fallback of LRB, or if it's a major that goes up the road, whatever. But I think you have got a problem that you do not have an appeal process for approval for the public who may object.
So I would have a bit of a concern about members being treated differently to objectors. If we say that members can call something in, but objectors, where there's 6 or more objectors, they then can't have that discussed by committee. I would have a bit of a, I think it would be difficult to explain why we were treating members differently from objectors.
I wonder if we're going back to ask Steve the question, maybe you're just coming in there, Steve, but it's what the potential workload, I just see it being negligible. But again, it remains open, and the 6, the statutory, maybe if a statute, when you have a statutory consultee objects, it will be refused anyways. But I remember quite clearly going through the process of, okay, when 6 members of the public objected, it would come in. That was clearly something that was granted to the council. So I think there's a distinct difference between members of the council and members of the public and the processes that are being applied. But in regards to the workload, say it's the next 2 or 3 months, Steve, I would imagine some work will have been done in regards to the workload, and this could potentially put on the ad hoc committee. So when it comes to that, how much workload would this potentially put on, taking into consideration it is only members' call-ins even as well, and past experience?
Chair, through you, frankly at the moment it's difficult to predict. we only have one application sitting that under this new arrangement would actually be ready to be determined by the subcommittee. It's really a matter for members to indicate what their preference would be. However, I suppose the purpose of this is really to help this emergency subcommittee to clear the decks of regular business to allow you to focus on this council's response to the national emergency that we now find ourselves in. So to pick up on the point that you were making, Chair, I think the public would fully understand that these are not normal times, that this is a national crisis, and we are, as an organisation, trying to strip out the kind of business as usual approach to allow key officers and also key members to focus on what this organisation needs to do to get us through and to help get the region through the crisis situation that we're now in. So I think my advice would be to set the decision on this into that context.
I think that the point that Ivor raised, though, that if it's the only crap of the whip that objectors have.
Yeah.
Give you an example. If you had an application for a business use in a business area, let's say Heath Hall, for a feed plant, that might never seen the light of day, ticks of all the boxes, went through, and then there was 200 or 300 objections because you're going to have various noise and that. They wouldn't have a chance to object to that other than a written letter. And well, it meets the criteria, we'll put it through. It's how that might be something that members in their role as the sort of, adjudicator of whether that issue outweighs the planning issue. What we consider as a material objection might be different from what the planner would. Whereas 2 houses and somebody says, well, it's going to spoil my view. No, you're not entitled to a view. So you wouldn't consider that one needing to come forward. And if the members were calling it in on the grounds that you have 200 objections against a proposal, is that not something that might consider something different? Might be 200, hopeless things, oh, I didn't like the look at it, whereas it might be one person has a good one. I know that's an issue. One good planning objection outweighs 200 that don't have any material weight.
Chair, just a couple of points. First of all, it's really a matter for members. If members want that sort of business to come to the subcommittee, then we'll bring it. The second point is that we have a set of planning policies and guidance which have been through member scrutiny and member approval, and applications are in line with those policies and that guidance. I also anticipate that, as a number of members have said, that the actual demands on the service are going to diminish over the next 3 months. People are going to be preoccupied with other things, frankly, and I suspect that the numbers of applications coming in, and in particular the numbers of type of application that Ivor's talking about, I expect that will pretty much dry up over the coming months, because these larger developers and larger companies are preoccupied with trying to keep the business going and look after their staff through this crisis. So I'm not sure that it's going to be a major issue, but as I say, it's really up to members to decide what business they want us to bring to this subcommittee. I'm happy to do
if there's a possibility, though, say, of if there were an application came up and there's a significant number of valid objections, that the decision-making process could be postponed until later.
That's one possibility, although we have to bear in mind that the applicant has a statutory right of appeal if we don't issue a decision within a particular time frame, depending on what sort of application it is. So the other thing that I'm certainly very happy to consider is, and this is where we can apply some discretion in here is that before such applications are finalised, we can consult with local members. If members would like a safeguard of that nature put in place, we can certainly put that in place, and where applications that maybe previously would have been caught by the schema delegation, rather than us just determining them, we would determine it, but we would consult with the local members before issuing a decision, and then we could take a view. Well, that one will need to be deferred until PAC.
Yeah, I mean, just the decision being made in consultation with local members, because local members will come under pressure if there's a lot of objections. But yeah, I think if you could defer, there could be some process by which some of these decisions might be able to be deferred if they were felt to be very sensitive. I think Ian wanted to come in.
We're only talking about a small number of applications, Chair.
Yes.
Under normal circumstances anyway, 95% of applications are dealt with under delegated powers. So we are only talking about that very small number.
Yeah.
I suppose I'm reasonably appeased with what Steve's saying there, but go back to the point in experience we've had with member calling, it's so limited. It's very, very rare. It's like hen's teeth. It's unusual for members to call in unless they think about something serious, reservations, whatever, in regards to that particular application. In this environment today, under the emergency processes and climate that we're in, the likelihood is it's probably nil. It'll add no work whatsoever to the workload to it. But I think going on the back of what you're saying, Steve, I think if we were still have retained the members calling, and this has happened in the past, that discussion would then happen with the member or the local board members in that area, and quite often it's been removed and it goes through delegated powers. That process is there, so a member will call it in. They'll have a discussion with the planning officers. Then they get satisfied with the questions they're putting forward being answered, and then it's removed. So to me, it's almost like 6 and 2 3s. I think this, by removing public speaking and allowing the committee to still determine plan applications only on member calling, I think it'll add zero weight, zero workload to the actual to the committee. I don't think there'll be any called in, very unlikely over the next 2 to 3 months. And if it was, and it's felt like, okay, a member's called one in and there's discretion that says, right, okay, we'll knock this back to September, August time, somewhere about there, then that's absolutely fine. It's ultimately still being open and transparent. And going back to what Ivor was saying, I think it was a very relevant point. If sometimes it does happen, an application comes in your area and it raises so much controversy, and if for some reason certain applications were to be getting approved without the appropriate level of committee scrutinisation, I just think it'd be wholly inappropriate. So I'd formally move after you've spoken, Steve, actually, because I think the members calling is the right way to go forward, removing the public speaking, but ultimately it had been through that same type of process. Okay, it could be removed after discussion with the planners, but it allows that to be absolutely in place. That's me finished, but I will move that. I'd just like to hear what Steve's got to say about it.
Well, I don't think there's much more that, Chair, that I can add. I think it's really a matter.
We already had something moved by Adam and Ronnie. I just wondered whether Adam and Ronnie would be prepared to consider also including within that the possibility of deferring decisions which seem to be very after consultation, where there have been 6 or more valid objections, and which after consultation with elected members would appear to be sensitive.
I think, to be quite honest, that discussing with members and the possible deferral within the statutory timeframes sits within the motion as is. There is discretion within option 2, and plan officers can use their discretion, in my view, if it comes in at the start of June. I can't remember exactly how long they have got, but there's a considerable amount of time there, and could go to the. We could leave it as late as possible to determine that decision if we can. So I think that that can be reasonably done.
Even if it went to appeal, I mean, it goes, then somebody else has to make the decision. They would have to look at the objections anyway if it went to appeal.
So, Leader, I'll formally move that we option 2 with an amendment that so we remove public speaking if that's not already explicit within it. When it comes to the committee, right? Okay, but that's removed and fine, and actually we still allow members calling.
Okay. Do you have a second?
I'll second it.
Okay, Adam, I rescinded. Okay, so the motion is as proposed by Adam and proposed by Adam and seconded by Rob. And the amendment is proposed by Ian and seconded by Jane. No, seconded by Adam, who got in before Jane.
Okay.
Okay.
Are we moving to the vote?
We're moving to the vote, yeah.
So, as the leader said, motion is proposed by Councillor Wilson, seconded by Councillor Nicholson. Basically, recommendation 2.2 as it is. Amendment proposed by Councillor Crothers, seconded by Councillor Hislop, is to allow the facility for members to call in applications for consideration by the subcommittee. Leader?
Motion.
Councillor Davidson?
Motion. Motion.
Thank you. Councillor Crothers?
Amendment.
Councillor Hislop?
Amendment.
Councillor Johnston?
Amendment.
Councillor Maitland?
Amendment.
Councillor Thompson?
Steve?
Motion.
Thank you. Councillor Wilson?
Motion.
Councillor Nicholson?
Motion.
We have 5 voting in favour of the motion and 4 in favour of the amendment, therefore the motion is carried.
Thanks. So what else? So we've considered the options, we've agreed to option 2, and we need to note there's currently no urgent business scheduled. Okay, item 8 is cessation of non-residential community charges. A report by Chief Social Work Officer. Wayne. And we're being asked to consider suspending non-residential community care charges due to the high probability that the delivery of non-personal care will be disrupted over the COVID-19 period. And Lynn is here to assist members. Do you have anything further?
Happy to add any questions, Leader, if there's anything that members wish to ask.
Any questions? Can you indicate if there's any questions? Okay, so we're asked to note the potential loss of income of 33,000 a week, as detailed in that. Presumably, it's a loss of income to the Health and Social Care Partnership, rather than to ourselves.
It's a loss to the delegated budget, yes, indeed.
And to agree to suspending the non-residential care charges for care at home and daycare services with immediate effect. Okay, intent?
Jane, I think, wants something.
Oh, Jane, sorry, Jane.
Yes, sorry, could I possibly ask, Lillian, you're not anticipating actually delivering this service. Is that what the real issue is?
Thanks for that, Councillor Maitland. No, we will continue to deliver the service, but you will have seen the bulletin that went out to members and members of the public and staff to say that we will be reducing elements of it. So you're absolutely correct that some of this service, as we move into the emergency situation, will not be being delivered, but we will still be delivering elements of care at home and personal care. So it's just that for those new service users, we'll be delivering on a reduced basis.
Okay, thank you.
Thanks. We go on to item 9, which is the revenue budget monitoring for social work services. This report provides members with an overview of performance against budget for each of the services functions based on the monitoring position at the end of the quarter of the financial year ending 31st of December 2019. Again, Lillian is here to assist members with any questions. Should I add anything?
Just to add, Leader, obviously we've already indicated to Social Work Committee that we may have to use that parachute fund, as I call it, my terminology, that is part of the Social Work budget, and Social Work Committee had already agreed that that was possible towards the end of the financial year if required. We have obviously continued during this period to try and reduce the budget. However, I think there still will be some overspend within social work budget at the end of the financial year. Thank you.
Okay, questions? Any questions? Okay, I will. Happy to note that Health Services has progressed a number of measures to seek to minimise the financial impact of the previously highlighted pressures. It is likely that we'll have to seek assistance from the Social Work Support Fund to cover the revenue deficit. Item 10 is the Appropriate Adult Scheme. This report is to update members on the changes to the Appropriate Adult Scheme, which introduced a new statutory function from the 10th of January 2020. And if people do object to this, I have to say I was one of the people who was involved in this going through Parliament. Blame me and others.
I think just to highlight to members that obviously it's now a statutory responsibility for local authorities. We already had a well-established appropriate adult scheme in place. I think unfortunately the only element that will be a challenge for us is the funding that came with it was quite limited to deliver on the actual numbers that we now are statutorily required to do so. So that's an area that we will continue to monitor, but I think the detail within the paper provides the members with assurance that we will meet this statutory obligation, all being that we need to continue to review it, and my proposal would be that we bring back regular reports to Social Work Committee.
Yeah. Any questions? Okay, so we'll note the change from a non-statutory basis to a statutory basis, the delivery arrangements, and we agree to receive further report on resource applications after a period of evaluation. And that may be the Social Work Committee, hopefully. By that stage, hopefully, the Social Work Committee. And the final item is 11, which is the interview and appointment to the post of Head of People and Transformation, and report by Head of People and Transformation. Okay, so we're just obviously partway through a process of the appointing a person to the post of Head of People and Transformation, and these suggestions about how that could be carried forward. Paul, is there anything you want to add to it?
Really just what's in the report, Leader. The process will perhaps have to be simplified, just simply for the fact it's an online process. We're currently looking at what the arrangements might be for the presentation topic. Ordinarily we would give candidates time to prepare a topic and then come in and address it. It may be that we choose to give a presentation topic to them in advance of the actual interview process, and we're looking at how we might do that sensibly. It's obviously more challenging if they have to do it on the day, having given time to prepare there. But the rest of it is, as you see it, there was a question about training, and we're looking at what members have been trained and not trained currently, just to identify, make sure that training's been given, and we'll schedule that in advance tonight.
So training is required for?
Yes, it's mandatory for all members to participate in the panel.
Fortunately, that's some training I have been through. But just, I appreciate that you picked up on the topic there, and that, the last, the Employment Appeal Sub Committee decided that, there could be that dialogue between officers and members about what that topic might be. I appreciate we were going to have a discussion about that before this all kicked off, but I think, I'd be quite keen just to know what the topic's going to be. Learning about what somebody wants in the first 6 months is great, but I think realistically where we are, who knows where we'll be in 6 months' time, and probably not the most appropriate topic, and not the most realistic of topics. So I appreciate that discussion offline, just so that we can...
We have a number of topics which we can actually discuss.
Okay.
Ian?
Just thanks, Leader. Just when I seen this, I did think, I thought this is something that just would have been put to the side as being in such an state of emergency. I just wondered if had there been a discussion with Paul, could he continue on or and keep this to the side till we get through this emergency, or he'd normally have a deputy, I would imagine. Could that deputy not take over under the circumstances? I think it would be a difficult thing to undertake. Maybe it's because of my lack of experience, but I've always interviewed people so I could see the whites of their eyes. I just think it'd be better to stick to the original format. So was there any other options, as in other emergencies, Paul would stay on, or even his deputy would take over until such time we get through this state of emergency.
Laura, good.
I think one of the issues that we looked at is how far into the process we were. So before the national emergency really escalated or really emerged to the extent it had, we had already been through the assessment centre. We feel that we can still progress with this. I think there's been a correspondence through our HR team with the candidates. The decision to halt it or not is really a matter for members. It's members decide the recruitment processes for all chief officers, so it's not something officers can just decide themselves. I strongly believe we will need to strengthen our team, notwithstanding Paul's retirement, in terms of making sure that we've got a team that came out of this very difficult period that is resilient and can support us. I won't ask Paul to comment on his intentions, otherwise that's something I would take offline, but certainly we understand that members may have a different view about the approach to this, but we would certainly see that this is a doable and an appropriate way to progress. We have a small number of candidates that have met the bar that members were discussed at the shortlisting, but it's really a matter for members to determine.
I think just to pick up on, the key line for me was, in 3.6, whether this would lead to an extended period of time, and may result in candidate disengagement from the process. I think given that, we are so far through in the process, given that it's only 3 candidates, and I think that it is more than capable of interviewing via technology. Obviously a very different set of circumstances for the 2 head of education posts. We were at the very beginning, and I think very easy for us to delay, but I think, I would certainly agree with the comments about actually the type of council that we are when we come at the end of this. And I don't think it would be a bad thing to have a couple of people who maybe have not been up at all hours of the morning for about 3 months or possibly longer, having done the breadth of work that's currently taking place.
I presume that appointment is that would be a discrete meeting of the subcommittee rather than in with any other business. So I'm just be a little bit concerned about a whole lot of rookie members of the committee being in there who have already just received the training or haven't had enough training. But presumably we could, for example, ask for substitutes. So I could be substituted maybe by the chair of the Employment Appeals Subcommittee for that particular meeting, so you could get people with experience actually onto the panel.
I mean, I don't have a tally, and I'm sure Paul will be able to do that, but I imagine many members around this room have had the training, and any member who hasn't will be able to understand that. It's, I don't think it's onerous. It's up to members in terms of your own arrangements for this ad hoc subcommittee, COVID-19, about your arrangements for substitutes anyway, but we need to make sure any substitute was trained.
I was thinking about substitutes maybe who had training, substituting for members on the committee who haven't had training. I mean, I've not had the training, for example. I think so I feel a bit uncomfortable doing, in 2 weeks' time, doing something that I've just had the training for.
We could pick that up individual members, but obviously looking around this room and indeed on the video, these are very experienced members and senior councillors or former leaders of the council. So hopefully, subject to individual members' views, I think that would be entirely manageable.
I think we had the training previously. It's not last year or that, but it's still current, so it's still valid. That's fine.
It's just the sort of format it would take. Would it be the subcommittee in here and the candidate? Because I think it would be difficult to have 3 of us here, as we've sort of agreed, plus 4 or 5 on here, and then we're switching on photos and stuff. I think we would need to be in the room. And I think also you've got the sort of, in the past, when you do interviews, you're in there at the start. Well, somebody might short break and nip off and come back, and you don't know if they've been away because they weren't on the screen. And it might be better if it's the 9 members of the committee in the room and the person just on
There's about having 9 members in the room, though. That social distancing would be difficult to mind.
We can move you into the hall. I think we can adapt to whatever members decide. We've managed to, I think some members will recall that, you know, having virtual meetings was a challenge 2 weeks ago. We're here doing this, so we can move mountains. We've done that the last week to make sure that we can support members in their role, and we would do that for this, and we would obviously go through any sort of specifics with members ahead of that to make sure you were comfortable with how we're going to arrange those things.
I'll make sure that members' levels of comfort are up, whatever it takes.
You're actually suggesting it's in 2 weeks' time, this appointment. Okay, people happy to agree that? Happy to agree that?
Agreed.
Okay, good. Okay, well, thanks very much for your attendance, whether in person or remotely. Cheers.
Thank you.
Oh, and can I just say, well done. Historic, a vote. Not only a remote meeting, but a vote.
Thank you.